a bus stop on Savi Island,
How do I use this? What do I do? Where do I go? Where am I going? I said.
was Gerlyn Grassrope's last stop before she was sent off to the streets of Portland.
I'm just being put out there where I didn't know nobody. It's like I wasn't given a chance.
For years, an Oregon addiction treatment center called Medicine Wheel took in Native Americans from around the country seeking help.
It paints a pretty disturbing picture.
If they didn't finish a year-long program, Medicine Wheel refused to help them get back home.
Portland was being used as a dumping ground.
How did this happen?
It's an alarming number of natives that need care.
And how was it hidden for so many years?
It's like they were used to that. They've done it many times for somebody for them to treat me like that, like it was nothing.
Jackson Paul worked for Portland Solutions, a city program tackling homelessness. He analyzed data from the city's reunification program, an effort to reconnect homeless people with their families and hometowns. Seattle topped the list as the place where most people came from.
And then tied for second place jumps out as Bismarck, North Dakota.
And that was stunning to you.
Absolutely unexpected, to say the least.
Emails, notes, and other public records show Paul's quest for answers. He contacted other city leaders. No one knew why so many people from North Dakota and South Dakota were ending up on Portland's streets. Paul's search eventually led him to Medicine Wheel Recovery Services, a treatment center in St. Helens, Oregon, about 40 minutes north of Portland. Medicine Wheel offers a year-long addiction and mental health treatment program for Indigenous people, often flying them in from the Midwest and the Great Plains Tribal Network. But when patients left the program early, they didn't go back to the Midwest. They were given a bus ticket to Portland, where many ended up homeless.
This was what they shared with me. Your ticket home was contingent upon you completing the program. And they said they didn't have the funds in order to send everybody home who was leaving the program for any number of reasons. I was stunned. I was absolutely stunned.
2 months earlier, Gerlyn Grassrope was one of those people. She's a grandmother from a tribal community in rural South Dakota. Last year, she decided she needed help, a way out from a family environment of alcohol and drug use.
I couldn't do it anymore, so I chose to leave.
She found Medicine Wheel, liking that it was designed for Indigenous people like her. Gerlyn says the nonprofit paid to fly her out to Oregon for treatment. But shortly after arriving, something felt off.
And I said, this wasn't right for me. I said, I didn't feel right. I didn't feel like the treatment placing was right for me.
Gerlyn says she told staff members. About a week or so later, they drove her to a bus stop and gave her a ticket.
He said, this is where it ends for us. He said, we can't help you anymore. And I wish you good luck. He shook my hand, gave me that bus pass and said, the bus will pull up over there. They jumped in a car and left me.
Gerlyn was 1,400 miles away from home.
I used to think I felt hopeless, but I said, this time around, I actually felt hopeless and helpless.
Unsure where to go, she didn't know anyone.
I was mad. I was scared. Nobody. I've never been in a city like that.
Gerlyn eventually found her way to a Multnomah County Resource Center and then to Cielo Treatment Center, where she started a new program.
I didn't know what to do because I said there was a reason why I came out here was to get alcohol treatment. And I said, I don't want to go home not being able to finish that, you know?
Now she's back home in South Dakota.
I'm going on 10 months clean and sober.
Amazed that she ever left a treatment center homeless.
I wish I had known that before I had went out there, that they didn't offer that if it didn't work out for me, you know?
When Paul uncovered Medicine Wheel's one-way bus ticket system, his first response was to offer help.
Let's make sure that when someone gets to Portland, that they're connected, and their response is fantastic. This is great, because we are going to continue doing this.
Then, he told Mayor Keith Wilson.
We found this one organization was dumping 1 to 5 people a month for the last 7 years. That is absolutely heart-wrenching.
Medicine Wheel reportedly shared that number, 1 to 5 people a month, with Portland. Paul referenced it in an email back to one of the nonprofit's leaders. If it's accurate, that means the organization discharged up to 420 Indigenous people to Portland streets since 2018.
For years, there were more Native American homeless people in Portland than you would expect to see,
Without question.
and you didn't know why.
No, absolutely not.
Local governments collect data on the Portland area's homeless population every year. In 2022, the point-in-time count reported Indigenous people made up 12.9% of the homeless population, despite making up only 2.5% of Multnomah County's population. In 2025, researchers said Native American homelessness had more than doubled in 2 years, citing a 118% increase, the largest of any racial group. Portland leaders, realizing the potential scope of Medicine Wheel's discharge practices, sent the organization a cease and desist letter on January 9th.
Brought to Portland without any resources to get back home, that behavior, that practice was cruel and it was costing lives. So we had to act, and we had to act fast.
Paul says that legal threat caused Medicine Wheel to quickly change its tune.
The response within a couple of days was, absolutely, we won't be doing that anymore. And surprise, we actually were able to find some new grant funding. So we're going to set some stuff aside and make sure that we're not exiting folks to the street anymore.
Medicine Wheel declined to comment on this story. We left multiple messages and showed up at their office in St. Helens, where a staff member turned us away. Public records show Paul and a Medicine Wheel supervisor emailed about their calls. The supervisor wrote she told staffers that discharging to Portland isn't a free ride or easy exit. Medicine Wheel is funded by taxpayer money. The Oregon Health Authority reports Medicine Wheel recently received a $1.6 million grant as part of the state's Behavioral Health Resource Network. So when Paul told the state what he found, the health authority started investigating. In February, a state licensing manager emailed him back, saying Medicine Wheel told OHA that it changed its policy 6 months ago, so they no longer discharge to homelessness in Portland. That means Medicine Wheel claimed it stopped providing bus tickets to Portland 2 months before Gerlyn says she was stranded on Sauvie Island with a bus ticket in hand. The Oregon Health Authority says it is still actively investigating Medicine Wheel. Medicine Wheel gave OHA a list of people who were discharged with a bus ticket to Portland. The agency says it's working to verify that list. Portland leaders don't know how many Native Americans from Midwest tribes have ended up homeless in Portland because of Medicine Wheel.
They could be home, they could be stable, they could also be dead.
Jared Murray leads Painted Horse Recovery, a treatment center for Native Americans.
I definitely think that the number has risen, and there is more natives, and it is disproportionate.
Murray says his outreach workers see an alarming need for recovery housing.
When people have a sober recovery environment, they thrive.
City leaders say they're looking for other trends.
I can say definitively we would not know that this was happening without the reunification program and the data that we collected there.
Portland's no longer that destination if you've been using and abusing our system.
Gerlyn, now holding her granddaughter, remembers an Oregon that was far from welcoming.
Traditionally, Native people in our culture, the Lakota culture, you don't do that. We help each other, regardless.